Thank you so much to our awesome presenters. What a great presentation. Lots of learnings for me to take away. And now I want to know from you, for all of those who are watching, if you have any questions or any insights or any thoughts of how you will bring this practice into your own organizations or into your own communities. So I do have a burning question right off the start. I am wondering what this looked like and how that changed from beginning, middle to end. Kind of what were your feelings? You know, what were the main activities that you were doing in getting this off the ground at the beginning, more towards the middle part, and then where you are now?
Thanks. Doug, did you want to?
Sure. Yeah, I guess. Yeah, I think we both.
Stab at it or me?
No, I mean we both have different beginning stages to this one for sure. But you know, I think from our perspective as a community entity, we were sort of working with the community at the time when the pandemic first broke out to find an isolation site for shelter clients who required that. And part of that need involved healthcare services, primary health services, because we couldn't very well take folks in active mental health crisis or substance use crisis and ask them to isolate in a hotel room for 2-3+ days, depending on if they had a negative test or not. So we really started the ball rolling with our Department of Health and our health authority early on. And I think like everybody, like the world was shifting beneath our feet, right? And asking large institutions to do something that it hasn't done before was not something easy, but just recognizing that we had to find a solution for this because folks were not going to be safe otherwise. And that was really the beginning of it, just recognizing the public health concerns required us to not just have shelter workers in place at an isolation site, but required a primary healthcare intervention on our end. So that really began the conversations. And we had many late night conversations, and we had many really sort of not confrontational conversation, but like it was such a stressful time for everybody. Like, how do you find a way to integrate something that hasn't been done within a health authority at a community level when everything else is, you know, going to the wayside? So it was a lot of back and forth, but a lot of co-design, a lot of collaboration in those early days. I don't know how you feel about that, Melissa.
Yeah, no, thanks for that, Doug. And I can build on it from a health authority perspective. So, you know, what Doug says is absolutely right. You know, we were meeting with various stakeholders across government and with our community partners. And as a health authority, we were just deeply entrenched in pandemic response, but then recognizing that this need existed for something that we hadn't done before. And because we hadn't done it before, with our organization brings lots of layers of checks and balances around professional practice and quality and risk. And, you know, our traditional resources really live in to go outside of an institution into a hotel-like environment, without those same kinds of controls. And so into programming that we hadn't done before. So we had lots of hoops to jump through, but we certainly were invested in it. We just, we had to figure it out. And so, how do we free up those resources? Something as simple as that when you're in the middle of a pandemic, how do you get nurses around the clock was a real challenge. And then, so, but we got there. I think in lots of ways we were fortunate. We didn't see the same magnitude in terms of outbreaks in the population. So that gave us time, and, the need was there, but then we got the time. And so once we were able to, just to speak to the second part of your question, to get to the middle of this sort of response or this partnership, it was really about how do we get the resources on the ground. We built the program, we've engaged the right people, we're in this together. And so let's get the resource on the ground to support COVID response. But when we didn't have the outbreak, it was magic, because we were able then to take this programming and really to grow it and to be able to build it in a way that was really meaningful. So, we took it, that sort of middle, that opportunity, and it just took off I'll say we had the right people. That's really important. Having the right people in the positions. I think that would be something I would say to folks. Make sure you do it and you do it right. The right leadership is important. Yeah, so I don't know about the middle, Doug, if you want to speak to that. And
yeah, I think the middle was just getting it off the ground and just making sure that, and to your point, like we were fortunate in Newfoundland and Labrador where the cases weren't very high, and so that allowed us to think, in addition to what a COVID response might be, like how can this be something that's further integrated into what we have as in St. John's as a downtown healthcare collaborative, which is Eastern Health led with a number of community partners. So how do we integrate primary healthcare services on the ground in a way that has potential longevity? And that was part and parcel of us sort of thinking a bit more strategically, like, our funding for this may not last in perpetuity, but if we can start to see some results and impacts, then perhaps this has a lot more value to the health authority and to the community than just a COVID response. So the idea was never to just like only have a COVID response in place. It was always knowing that we have low cases, we can have nurses out in the community doing street reach and outreach walks, and they can go and make visits to shelters. They can do the test for folks who haven't had tests done. So lots of really good positive work that can come out of this, and that's kind of where the middle was. And I think Melissa and I were in a strategic planning session with the health harm reduction team a couple of weeks ago, and we were just remarking during the break, like 18 months ago, this was like an idea, and here we are with a team of nurses, pharmacists, occupational therapists, and several folks from the community who are just operating now, fully operational. And to hear the stories and the impacts that they've been able to make in such a short time was really heartwarming just to hear the impact that they've been able to have. And hopefully that's the kind of change that we'll see, not in a post-pandemic world, but just as something that's really critical to housing outcomes, is to have access to primary healthcare and making that available to folks who typically haven't been served by those institutions very, very well, will help to add to health equity and housing equity, and hopefully achieve better outcomes in the long run.
Yeah, just a quick add to say, and to see our teams working shoulder to shoulder, so leveraging their, each other's expertise, is something that, it's been just a really nice thing to watch, and something that we see as absolutely necessary from a sustainability perspective. Can't do it alone. And so that's been one of our biggest learnings as well.
Thank you so much for that. I think this is just such a strong example of the urgency that was in place that really led to some much needed collaboration. And now, this is becoming more and more integrated into your daily work, even when you do have a second to breathe and you're not in full-on response mode. So that is amazing. I do have a question here from Chantel. She was asking, she says, first, this is a fantastic collaboration. She's wondering where supportive housing fits in. Are there plans to complete a perfect trifecta of permanent supportive housing, integrated primary health care with homelessness prevention and support? If so, what are some lessons or tips to replicate this in other communities?
Yeah, I guess I can jump in on the housing piece.
Perfect.
I think right now what we're trying to make sure is that those nurses get acclimated and have build trust at the community level, just visiting the shelters. So we haven't used those resources to leverage any further investment into like a permanent supportive housing project. There's no plans on the immediate front on that end. But where I certainly see opportunity is integrating these primary health resources into our coordinated access. We call it coordinated access to homes. We rebranded it in St. John's to keep that focus on housing. And one of the biggest barriers for folks in our community is that often supports will end once somebody receives a lease and a key. So we recognize certainly there's opportunities there. I know from our end at Homeless St. John's, we work with the community and number of private market rental landlords through a program called Home Connect. So we're looking at ways that we can access and tap into this private market, because there's simply just not enough affordable and accessible housing. But we do have another program, and so all tenancies that would go through there would be done through coordinated access. And I think as individuals are identified as needing supports, For example, like one of the resources that we talk a lot about at Eastern Health was integrating an occupational therapist into that. So an occupational therapist can help immensely with an individual who's now moving into a home and have that housing set up. So there's ways that we're still thinking and brainstorming that, but you can kind of see the pieces coming together. It's just, how do we want that flow to look like? But certainly the commitment is there. When we think about permanent supportive housing, that really is a provincial jurisdiction, like to the Newfoundland and Labrador Housing Corporation, and we don't have any plans at this immediate time. So, but there are ways that it can be integrated, whether it's a supportive housing project or private rental markets as well.
That's great. Thank you, Doug. And thank you, Melissa. Or sorry, Melissa, are you going to say something?
No, go ahead. No, I was just going to say Doug hit the nail on the head there. All good. Thank you.
Yeah, I totally agree. And I think there are tons of great learnings that you can take from this partnership and working together. And as you move in and think more about the permanent supportive housing piece, like learnings through collaboration or even what worked in terms of communication and from small things all the way up. So I think that's great. I have a question from Maggie. She is asking, how many people were served over the last year?
Oh gosh, Doug, I'm going to be honest. I would have to go looking for that information.
Yeah, I'm not sure either. It because it varies, I think, right? Because the interventions that are provided, at the shelters versus outreach walks versus, the COVID response at the hotel, designated hotel site, all vary. But geez, I would have to say in the hundreds, Melissa.
Absolutely. I was just going to say the same thing, Doug, hundreds. And you're right. So it depends on the clinic. It depends on, the hotel, street reach, shelter visits. Like lots of times it's the same individuals, but other times we've had sort of one-off. So.
And just thinking too, like the harm reduction team was really involved in doing the vaccine rollout at the community level too. So even there, I think your team saw like almost 1,000, if not more.
Yeah, you're absolutely
just to deliver vaccines to vulnerable folks at the community level. So yeah, like this is a really like utility type of plug and play resource that we're able to work with, which is super great. But the numbers do vary based on the type of intervention being provided.
Thank you for that. I have a question and a comment here from Celeste. So Celeste says, I don't recall how many units were supported and how long can tenants remain housed through this model. Are you able to discuss, as well as how it is integrated into the broader homelessness serving sector? Are clients impacted with concurrent disorders welcomed, tertiary care, forensics? How is safety managed for those? You mentioned recruitment being a critical aspect of your success. Would you be able to discuss? So there's a few things there, so I can pinpoint them out if that's easier, unless you have some thoughts right away.
Yeah, I'd say let's break them down and might be able to be a little bit more effective.
Yeah, I think let's start with her last question here, because I know you said, just having the right leaders in place really made the difference for you, and having the right folks in place. So, she's asking, you mentioned recruitment as being a critical aspect of your success. And you also talked about being able to recruit, nursing staff during a pandemic when they're in very, very short supply. So maybe you could speak a little bit more about that, or any strategies that worked, or key learnings from that recruitment process, and making sure you have all the right players at the table involved.
Yeah, I can speak to that. And so just to say, I guess if we start from a leadership perspective, we were very fortunate to be able to, to second, for lack of a better word, somebody who was already part of our team, but that was a very strong leader who had exceptional skills in things like communication, relationship building, empathy, like you name it. She sort of was the whole package in terms of being able to really and had quite a bit of experience. And so I think that's really important. She was able to manage a project in a way that was very effective, and she could do that independently. because we were in a time of chaos. And so I really needed somebody who was going to be able to take it and run with it. And she certainly did. So that was important. But then in terms of the recruitment, what I would say is it is critically important. We were very strategic in how we posted positions. And so in a world such as ours, where it's a unionized environment and lots of times competitions are seniority based, we had to be really thoughtful about what types of qualifications individuals had. And so a background in mental health and addictions was key. Many of our positions were listed as having to have leadership qualifications. And so we interviewed for most of our positions, and we also posted in such a way that there was a minimum number of years of experience that was required. And so that really made a huge difference. And in cases where we felt it was a make or break position, we were able to, and again, within the collective agreements, to temporarily assign the right people to the work so that we could lift it off the ground. Doug, I don't know if you want to add anything there or if that hits.
Yeah, I would just say on our end, we got really lucky because, we were leaving the city of St. John's to be into our own nonprofit and homeless for St. John's now. At that time, the pandemic broke out, and we were a team of 5, and we had a seconded staff through the city who was running our pick count. And we had to cancel the pick count because it was scheduled, I think it was March 24th. And her background, she had 2 master's degrees, and one in public health and one in immunology. And we're like, how about you become the leader of this pandemic response? And so she and I just kind of worked on that, especially when the federal government announced that first round of COVID emergency funding. So having the right skill set and the right people in place was so critical. And working with Eastern Health, Melissa and her team has been just such a great example of how collaboration can really happen, because nobody ever talks about what we have to gain out of this. Is how can this investment become a bigger, it can generate bigger outcomes in our community. So I think just putting everything aside to focus on the outcomes was really important for that.
That's awesome. When you said, we've transferred out into a nonprofit, and in my head, I went, hashtag we can end it. And I wanted to yell that out. That's awesome. So I have another question here from Erin. Erin was wondering, how hard was it to get enough financial resources to fund this program? What are the main sources of funding, and will this funding be permanent?
I'm sure Doug will add, but I can say to you, hard. It was, we're in a situation in our province where, a fiscal constraint. And so, I think we really just had to do due diligence in terms of painting a picture of a gap in the community, which we knew existed for quite some time. Pre-COVID, this gap existed. And so, by I guess being strategically looking at what resources already exist and didn't exist, we were able to leverage some funding through the provincial government, which we're very thankful for. But in terms of long-term sustainability and our sort of moving from year to year, we've been very lucky in a partnership with Doug. And so, it's really, we're doing this together, funding and otherwise. And so I'll let Doug speak a little bit about that and where that piece of the pie comes from.
Yeah, I guess to one of your points there around operating in a fiscally constrained province is a challenge, but one of the things that we were able to benefit from was the emergency COVID response funds that were made through Reaching Home. So we worked with our CAB to identify a number of priority areas that we could invest in. We had the COVID isolation site, we had the food security issues going, but the biggest one was working with Eastern Health around the harm reduction programming. So we were able to co-invest, and I think we made it really clear, we're not just here to say what we need and not be involved. We wanted to invest, we wanted to be partners because we knew the benefits of the community was going to be really important. So the long-term sustainability of this is really critical, because we've been told by the Fed that incremental funding will happen, but we're not sure how that will look. And I think the other piece to us over the last year was a lot of the COVID funds. We did some trickery, I will say. I hope nobody from ESDC is listening here, but we didn't want to be bound by those time limited funds, so we reprofiled our base funding under the COVID fund and we're able to stretch those additional funds into this fiscal year and hopefully beyond. So we did whatever we could to make those funds stretch beyond that June 30th deadline this year. And so what we did was we front loaded through our funding the 2 year or the first year of the partnership, and then Eastern Health backloaded it so that way we could meet our administrative requirements. So like things like that are a bit monotonous, but they're really important. And then the sustainability long term will depend on the incremental funding that's available through the Reaching Home top-ups. Like those top-ups for us as a community have allowed us to invest in this partnership, but have also allowed us to add, additional 280 spots of case management and community supports to the community across a number of community organizations that we could maintain if those funds continue. So those are the types of investments that we're going to need to see in order to really make long-term changes. But one other piece of this is that we're doing an evaluation, and the evaluation piece was so important for us within Homes St. John's, and for sure your team with Melissa, I'm sure, because if we can start to show results, hell was going to be a hard place to be for that person who tries to cut this program in the future. So I would not want to make the cut when they're showing results. And I think that there's going to be a lot of opportunity to do great work, but it's going to require some pieces there. And I think there's a lot of shifting sands within healthcare in Newfoundland and Labrador. So I'm optimistic, but like there is a finite amount of time here we have.
Yeah, you just took the words out of my mouth. I was going to say evaluation. So if there was something I would share with folks that are listening is, start to think about that right out of the gate. Engage who you have to engage around evaluation, around outcomes, and absolutely, we've got commitment from the government to say like, we can show you how good this is. Doug's right. You'd be hard pressed to say that we would stop it, given I can say right now that the impact that we've had is great, but the numbers will tell the story and the outcomes will tell the story once we go looking for funding.
Yeah, speaking of evaluation, I can't agree more. Like evaluation can be such a helpful tool to advocate for continued funding and to show successes or where you might need to boost up particular parts of your response or program. I'm wondering, we briefly heard during your presentation a little bit about the evaluation, but what are some like 1 or 2 key performance indicators or things that would tell you that yes, this is working the way that we want it to work and it's going the way that we intended it to go? Like, what's something that, folks on the line could think about measuring or tracking in terms of their data to really show, is this working or not? Is it making the impact that we would like it to make?
Doug, did you want to speak to housing, or did you want me to go for the housing?
Oh, I think, yeah, I think housing is almost secondary to some of the impact that you've had to date. It's been so great.
Yeah, no, thanks. So, I guess there's a number of different things that we're looking at, and that integration with housing, or that coordination with housing, is obviously a big one. In terms of key performance indicators from a primary healthcare perspective, we look at things like access. We look at things around chronic disease screening. We look at things like rates of admission, and this is very health heavy, but what we started with, I guess, and it's been, again, very interesting, is even something as simple as client satisfaction and access based on their satisfaction. Goodness gracious, I'm just trying to think top of mind. There's so many outcomes that we're measuring around the social determinants of health. And so just to say that the other piece, I guess, that's important from an evaluation perspective is we utilize the electronic medical record. And so by building, of course, we build it so that the information that we put in is very purposeful. And so, when we want to pull it out, we know that, that's been templated in a way so that it can be connected back to our outcomes. And so that has been, again, key to our success and something that we've built from the ground up. But yeah, again, I'm happy to share our evaluation framework for anybody who would like to see it. I'm at a loss now at the top of my head because there's so many, but there's lots of key KPIs that we're monitoring.
Yeah, And I think the other piece to that too that's is important is that it's not Homelessness St. John's or Eastern Health doing the evaluation. It's the Newfoundland Labrador Center for Health Information. So that sort of third party just is really, really crucial to this.
Absolutely. I think too, in terms of evaluation, especially with a third party taking it over, or kind of leading those pieces, what might also be helpful is some of those more process pieces of like evaluating the partnerships and the conversations and how that all worked. And so I wonder if there's anything in terms of the process of working together, of getting this off the ground and continually improving it, that you would say was a particular challenge, or that you would kind of caution folks to make sure you pay attention to this throughout this process if somebody wanted to replicate this in another community? I know I didn't ask a very clear question, so let me know if you want me to rephrase.
Yeah, I mean, from our perspective, Melissa, like I think the idea was like if we can have somebody available for the COVID response when somebody needs to be isolated, like that's all we need. Like we're really simple, like that's it. And then as well, like when that's not being busy, how do you integrate those resources at the community level? And I think that's not, we don't have to worry about things like liability or professional practice because those resources are part of the health authority. So it's kind of easier for us to just not have to be involved on some of those, but recognizing that those take a lot of time to work through.
Yeah, no, fair. Just if you could repeat the question again.
Yeah, that's a challenge,
I'm
Melissa.
just trying to think now if I might add something because I'm not sure I understood it fully.
No, thank you, Melissa.
I'm not sure I
It's
understood it fully, but yeah.
I'm saying it's a challenge because I think I asked like 5 different questions at once, so I'm sorry. But I was more so getting at, you know, what's your own evaluation of the process? What are some things in terms of the process of how you've gotten this up and running that you would really want to share with other folks on the line of something to pay attention to, or something that you've noticed in terms of more of a process measure rather than an outcome measure?
Yeah, great point. Yeah, and I think Doug hit on it for us too. It is around that more complex, I guess, integration within a health authority. And so everything we do has to, it sometimes feels, and I'm being very honest here, that it takes that much longer. It's just that much harder to lift it off the ground for good reason, again, but in a pandemic, in a time of urgency and when time is, is key, that becomes an extra challenge. I mean, I would just say, really stop and think about who your key stakeholders are, engage the front line where you can to understand the work, ensure you've got the right people pulled in at the right time, because some of that, we certainly, like Doug said, we had many a meeting and lots of times had to go away and, understand a bit more about it and then come back. And, again, when time was of the essence, it probably would have helped us to have the right people at the table right from the start, from my end. But there was lots of learnings from a process perspective. And I guess to layer on to this, we were working with other community partners who also had their own mandates and had their own sort of visions and feelings about how this should look. And so we had to put our heads down in some cases and say, okay, what is the best thing for the population? What is the best thing for the community? And build it that way, as opposed to being more focused on a particular organization, if that makes sense.
Absolutely, it does. Yeah, thank you so much for bearing with me through my confusing question. That's awesome. Thank you. I'm also just wondering, what are some ways that you really celebrated this amazing, innovative work of the teams, of the folks that have come together? Like, are there any things that you have done to show your appreciation? And I'm asking because I get asked this question all the time in my work. Like, what are some ways we can really appreciate all of the folks that are really doing such strong work in this area and kind of showing up every day with that level of energy that is amazing to me. So yeah, any tips for appreciating teams, or what are some things that you've done to really show your appreciation and to help motivate people to keep going, trekking this brand new path, this brand new project?
Yeah, no, it's a great question. And it's a tough, it's one that we probably would have been it would have been a lot easier in a non-COVID world, right? Where you can't get face to face and you can't do those same kinds of things you wish you could do. But nonetheless, I think we've done it. I guess a couple of things that are more forward facing is Tug and I have had the opportunity to share the successes with some of our local media outlets. And I think that's been really positive for our teams because the community has embraced it. We've had lots of positive feedback, and we always ensure that makes its way back to the folks doing the work. We, as we said, we engage in planning days together, and in those days, we take the opportunity to celebrate the work, recognize the work, build the team, because that's really important too. But yeah, we, I guess as a health authority, I can speak to have different events in terms of recognition. And so we just ensure that those guys get recognized in a way that's meaningful to them, because they would put their heads down and not put it up again, doing the work. And so that's really important. Doug, I don't know if you want to add anything there.
No, I mean, the bulk of the work right now is being delivered by your team, and we have some shelter staff that oversee the COVID hotel. And I'm typically terrible at showing appreciation for things, but I mean, the ability to work so collaboratively is like, I could call Melissa or folks on the Eastern Health team is great. But I will say that the best compliment I think I ever received was from one of the members of your team, Melissa Judy O'Keefe, who was on our cab, and she told me that she, every time I see her, she usually tells me I'm a pain in her side, and that if she was in my shoes, she would do the same. So I think that just shows that we're just moving these larger institutions and these larger opportunities to work together. And I think that's a really good thing.
That is great. Thank you so much. Okay, I am going to wrap up, everyone. Thank you so much to our presenters. Thank you for those who joined this presentation and to those who asked questions. Please evaluate this session. I think the button is located underneath your video player beside where you were chatting and putting in your Q&A. And we will have a closing activity or a closing event at 2:45 Eastern time, so in about 15 minutes from now. So take a break if you need to, and hope you enjoy the rest of your day. Thank you so much.
Thank you.
Thanks again.